'cause I just can't get you out of my head. Fight the connection, but the emotion keeps on pulling me in. Try to resist you until I hear you.
Hi guys, I welcome you all back to another session with me, Grace Williams. My topic for today is a condition that I'm very sure most of us are experiencing because it is something that is very common. My topic for today is insomnia, and I do experience it myself sometimes. Insomnia is a form of sleep disorder that makes the initiation, maintenance, and duration of sleep very difficult. With insomnia, one finds it very difficult to fall asleep and even stay asleep. We have the acute and the chronic insomnia. For acute insomnia, it happens when one goes through a life-stressing event like losing your job, losing your partner, divorcing, and then travel. There are some people that when they move to new places, they find it very difficult to sleep because of the change of environment. With acute insomnia, it happens over a short period of time, normally from weeks to months, and then it resolves on its own, especially when the stressor is being resolved or removed. Also, let's move on to the chronic insomnia. For the chronic insomnia, it happens over a long period of time, and then it's being treated with medications. It normally lasts for months to years. Now to the causes. For the causes, we have medical conditions that can cause insomnia. We have the bad sleeping habit practices. So for the medical conditions, we have the sinus allergies. We have asthma, which is related to breathing problems, which can interfere with your sleep. We have low back pain. We have the chronic pain, and then there's sleep apnea. With sleep apnea, the airway becomes either partially or completely obstructed, and then this causes the oxygen level to decrease, which makes breathing very difficult and then interferes with your sleep. To the bad practices, which I'm very sure most people do this a lot. 1. If you're taking caffeinated food just before bedtime, it's going to interfere with your sleep. Caffeine in general is good when taken in moderately. I know that when you take it in the morning, it makes you alert and very productive, and you are able to do what you are to do for the day. But when you take it just before bedtime, it's going to interfere with your sleep and make sleeping very difficult. Taking in alcohol, smoking, which can affect your lungs too. Eating heavy meal just before bedtime will cause discomfort and make sleeping very difficult. Taking in spicy foods can cause heartburns, which will obviously make your sleeping very difficult. Being tensed up, engaging in argument just before bedtime will affect your sleep. Thinking about the unforeseen situations, being anxious, thinking about past events, and even responsibilities all do cause sleep apnea or insomnia. Let's move on to the signs and symptoms. For signs and symptoms, we have the people who would wake up during midnight and will not be able to sleep again, and others too will find it very difficult to even initiate the sleep. We have other people too who wake up before their desired time, and then people who are depressed. If you are tensed, if you are depressed, if you are anxious, they are all signs and symptoms of insomnia. To the treatment, we have some of the conditions, some of the classifications of insomnia do resolve on its own without any treatment. But the other ones too, we prescribe the sleeping pills and then the antidepressants. Then after that, we have something called a cognitive behavioral therapy, where we have one-on-one session with the individual or have a group therapy, which also helps a lot. To the prevention, what are we going to do to make sure we have enough rest? 1. Avoid taking in caffeinated food just before bedtime. Avoid smoking and taking in alcohol. Avoid eating heavy meal just before bedtime. Make sure you drink enough water. Make sure you exercise so that your body becomes very active. And then make sure that you also avoid any other thing that will cause sleeping problems very difficult, like being on your phone for a very long time or watching television the whole day. We know that the normal sleep hour for adults is 7 to 9 hours, so make sure you have that kind of rest during the night, and then make sure you practice all that I have said today. This is what I have for you today, and I really hope this helps and we all do the right thing, because our bodies need to rest at a point. Thank you very much for your time, and then see you in another video. Bye.